There are so many gaps when it comes to TB. I think one of the things that I think they are lacking is the information and the awareness that we do and give to the community outside the health premises or facilities. That is family-centered care, which I believe in, because if you go to the community, that's where you're not only focusing to the patient itself, you engage with the family at large. You know who is taking tick in this family, you know who is the breadwinner here, and you all sit down and you make set up goals that will take this patient through. So you find a broader way to support the family rather than supporting one patient that came to the clinic.
My work has taught me that it's very inequitable who gets TB. And TB is driven by poverty. But also, if you take the case of gender, about 2/3 of the world's cases of tuberculosis are men, and people who have worse outcomes on treatment are men. And so I think that in trying to address tuberculosis for all, we're going to need to try and tackle some of these issues related to poverty, related to gender, and other factors, including, for example, if you belong to an indigenous community, disability. So I think these are all factors that we have to try and address in this fight against TB.
So something that I think is incredibly important is being able to work directly with communities, and communities hold such valuable insight and so much wisdom as well that can be captured and be utilized in meaningful ways. And so, when we think about equity, it means working directly with communities and really valuing their experiences and their insights.
But what is still a gap is just for us now to really engage with patients and find out from them what are the particular barriers that are preventing them from getting into care and staying in care. I started to think that, no matter the advancements that we make as a community of TB researchers or TB funders or whatever, the advancement in diagnostics, the advancement in treatment, having the best healthcare systems that you can imagine and all of that, if we didn't have a way of bringing the people that needed it in the door, then we were really not hitting the mark in terms of what we should be doing.
My work in relation to TB revolves mainly around the role of gender, and I look at that mainly also from the Global South perspective, especially Southern Africa, in terms of how gender contributes to men having more rates of tuberculosis. And I'm looking at gender also in the broader sense, not just men. I always try to emphasize that men do not live alone. They're not constructed as masculine without their relationship to women and to other genders. So their role is actually a social role. And for that reason, if we manage to rope in men and attend to men as a group with special needs, we are also able to attend to the TB needs of women and children and broader society.
For me, it's very important that health is recognized as a human right issue. Health, well-being, and dignity of a person, and it is not overshadowed just like by cost effectiveness rationalities, which is often happening. And particularly important it is in TB response and in TB resource allocations, what values are driving these decisions and how to ensure that access to TB care is perceived as a human right more than something else, more than this economic-driven agenda. So that for me is very important, and also for me is very important to work to ensure linkages between TB as something which is related to health sector, with other sectors and stakeholders, with social welfare, with civil society and affected communities, with education, with different, with private sector also, but also with different governmental sectors and governmental levels. So it's taken as a priority for all of them, and there is this collaboration. So this multi-sectoral approach is also something which I think very important for equity.
So we are a group of social scientists using the platform of ShiftTB to come together and discuss this question of equity and how the methods, the sensibilities, and the approaches of social sciences can be fruitfully engaged to help shape an equitable TB response, but also to take a more, take the time to come together as social scientists and take a critical look back also at our own work. How can we do better? And how can we systematically support the NTB strategy around this concept of equity with social science insights?
So I think what brought me to this SHIFT event at the Brusher Foundation was really working across disciplines in the same shared goal, obviously to end tuberculosis, but also to think about how we can reach everybody with the intervention, the policy, the frameworks that we're putting in place, and so that nobody gets left behind.
Okay, so I have used social science, and by that I mean talking with individuals and understanding their relationship or their interactions or their lived experiences within their communities and within the society to understand, equity and how we as TB researchers or TB healthcare workers should be navigating equity in our own work, right? So talking with patients or talking with individuals wherever they live and understanding how their identities, how their income, how their age, how their gender impacts on the way that they access care has been very helpful for me, for example.
So when we're thinking about equity, we're thinking about the distribution of a resource or something. Mm-hmm. And so I think that one of the things that social science provides us with is the opportunity to ask questions about context in which distribution occurs, and allows us to better understand the kinds of things that we ought to be distributing, the kinds of things that we want to equalize, and interrogate empirically what are some of the positives and negatives of a particular policy approach versus another.
Yeah, I think there's a lot that we can do in terms of equity in the TB response, especially when we think about more than just biomedical responses to TB. There are a lot of socially complex problems and challenges when we think of TB that really require a stronger understanding of people, of the conditions in which people live, and the complexity of people's lives. And so this offers an opportunity to better understand those, but also better innovate and come with solutions that are more creative and also equitable, that actually can benefit people's lives directly.
In terms of the people that get recruited into research, I think there are some systemic barriers to who is involved in research, whether it's because of education or literacy, or it may be because of disabilities, like ability to communicate, or hearing or visual difficulties. I think in order to achieve equity, we would need more inclusion of populations that often get excluded in research.
Great. What do you think?
Yeah, so I think one of the things that's missing is global health is being thinking about recently in the last, say, 5 or 6 years. There have been people who have been thinking about it much longer, but this idea of colonialism and decolonizing global health, thinking about racism, thinking about power dynamics. And I think one of the things that we don't do well in tuberculosis is that we're not actually realistic with ourselves. What we're missing is a frank discussion of not just the social determinants of health, but the political determinants of health, the historical determinants of health. So we need to talk about racism, we need to talk about colonialism, because that isn't just something that's in the past, it's something that's occurring now when we're looking at income in inequality and inequity in terms of why is it that the Global Fund only gives a much smaller portion to tuberculosis versus HIV/AIDS. There are historical reasons why that might be the case. We need to interrogate that, and we need to be honest with ourselves. And so I think that in the TB world, I think oftentimes we're afraid because we're afraid of insulting people. So we need to think about how we can ask questions about money, about power, in ways that actually will move things forward in a way that is meaningful to communities.
Both as an epidemiologist and a health economist, and a lot of the questions that I get asked are, whether new technology or novel treatment regimens for tuberculosis should actually be adopted, and so I believe that this is really important from an equity lens, because if we don't properly assess the health economics, we can end up making perverse choices around which interventions should be funded, and then you're not getting the most value for your money. You're not getting the most health benefit amongst these limited resources. So obviously, if resources were unlimited, health economics wouldn't be important. But recognizing that we all work within very limited budgets, we need to be very cognizant of those trade-offs that we're making, and ensuring that we are supporting not just cost-effective choices, but also equitable choices.
I think Geneva is just quite a strategic location to hold this sort of a meeting. We had the opportunity to engage with many Geneva-based actors and networks, and just have a dialogue, begin a dialogue that I think some of us have already begun, but others are joining, and to show some sort of unity, some sort of collective voice in why social science matters in this quest for equity in TB. And at the same time, I think we also came together to connect scholars who are working in the social sciences and TB in different parts of the world, and other members of the community, such as civil society and TB-affected community members, scholars who are working in disciplines that are not always seen necessarily and recognized within the social sciences, just to explore the diversity of social sciences, and bring them together at this wonderful, beautiful location in Geneva.
Though my role at this Shift TB event mainly involved assisting with coordination aspects, I was also there as an eager learner, passionate about understanding ways to improve equity in the TB response. The theory I learned from my master's was coming to life as the inspiring contributors explored issues of power and questions of accountability. Listening to first-hand experiences from community members and civil society was especially impactful, painting such a clear picture of some of the barriers to achieving equity in the TB response. Despite some minor stress involved with the coordination side, I am so grateful for the opportunity to attend this event. It was truly a rewarding and unforgettable experience.
Hi, my name is Angela, and I had the pleasure of being an events coordinator for the Shift TB brochure workshop this past November. After numerous hours of putting together the moving pieces of this event, I got to see it come to life as everyone gathered around the table for 3 days. It was so inspiring, to say the least. I think the biggest takeaway I had from a student's perspective is just how much value there is in having such a meeting to bring people together from a diverse group of backgrounds with a common goal. We had expert researchers, educators, grassroots organization leads, frontline and community-based individuals. Though there were some great sessions planned, I think that the fruit of what came out in the in-between, the coffee breaks and the lunch chats, are often what's missed when we have catered our world to Zoom meetings and online calls. Though there is merit in that as well, I do think these kinds of events, the ones that bring us face to face, are deeply inspiring to witness as a student who hopes to also bring value to meetings like this in the future.